Hello everybody, welcome. Today I'm going to show you some pressure points to use for breathing problems, asthma, congestion in the chest, and just to expand our lung energy so that we can breathe and take in all that life has to offer. So I'm sitting outside in my garden today so that we're in the fresh air. Without oxygen, the food we take will not feed our bodies. We need the oxygen to convert this food into energy. And it's the energy that produces heat and gives us energy so that all our systems can function. We can exercise, we can breathe, we can improve our circulation. So the air we breathe contains about 20% of oxygen, 21%. 19.5 to 21% is the amount of oxygen we need to breathe so that our cells function efficiently. If this level of oxygen is lower than 19.5%, then we are deprived of oxygen. Our bodies become oxygen deficient, our cells become deficient, they build up toxins, our bodies become acidic, and we feel sluggish and slow and lack energy. When our breathing is challenged in any way, it affects our nervous system, it affects our blood circulation, it affects the functioning of our organs. It also affects our mental and emotional state. When we breathe calmly in and out, our mind is calm, our body is calm, so it has a calming effect. So you can observe your breath. Say when you're worried or anxious, your breath becomes shallow and slow, and if you're angry and frustrated, your breath becomes quite deep, fast and rough. So this shows you how our breathing affects our emotions and how our emotions affect our breathing. If you don't eat food, you can survive 3 to 5 weeks maybe. If you don't drink liquids and water, you can survive 3 to 5 days. But if you don't breathe, you can survive maybe 3 to 5 minutes. Breath is important for life. So what about asthma and bronchial problems? People suffering from asthma have difficulty in breathing, they have a tight chest, they may be coughing and wheezing. The bronchioles of the lungs go into spasm, which makes it hard to expel air, and so they really struggle to breathe and exhale. Western medicine treats conditions like this with medication, which helps relax the muscles and open up the bronchioles so that you can breathe easier. Acupressure is based on the principles of Chinese medicine, so working pressure points and improving the flow of energy and increasing your breath. This improves the body's natural resistance to breathe properly, and it also then supports our immune system. Your lungs and your immune system go hand in hand because life force energy that we breathe spreads from our lungs to our entire body just under the skin. And this is known as defensive qi, which protects and defends our body from the invasion of external pathogens. External pathogens can be viruses and bacteria, but it's also exposure to the elements like wind, cold, excess heat, excess damp. And I have my assistant here today, Fred. He will help us locate the pressure points. I will use Fred to show you. He's very happy to share his pressure points with us. Fred, did you know that there is an institute, Acupuncture Institute in California, that did some research, and they gave people with breathing problems and asthma 20 minutes of acupressure treatment and found that 4 out of 5 people actually improved their breathing and lung capacity by 20%. Did you know that, Fred? Fred's a very silent type. He doesn't say very much, but he's happy to be here with us. Just a reminder, if you haven't seen any of my other videos, the techniques of acupressure and the way you use it and the way you breathe with them is what makes them effective. It's not effective just to push a point and hold it. You need to find that point, find the area that's the most sensitive, using your thumbs and your fingers to apply pressure. Your pressure can be deep and sustained, and you hold these points for 2 or 3 minutes, sometimes even 5 minutes. When you are doing this at the same time, you are breathing. So remember to breathe all the time. Breathe and focus. Bring your intention here where you are working your pressure points. As you can see, I've helped you today by putting some pressure points on my body so you can see what we are going to work on today. And I'm going to show you some pressure points that will help relieve breathing, relieve tight chestedness, and the symptoms of coughing and wheezing that go with it. And we do this, all these pressure points are in the upper body, and they support all the large muscles that help with respiration. So when you work these pressure points and you relax those muscles, it allows the lungs to expand and it eases your breathing. The first point today is just below your Adam's apple. It's about 3 fingers below your Adam's apple, and if you feel your collarbone, there's a slight indentation just above your sternum bone. This is the point we're going to start with. You can just use your finger and you just apply nice, deep, sustained pressure, remembering to breathe in and out and hold. You can hold it for 2 to 3 minutes and just hold. This activates the lung qi. It also activates the stomach qi, so it's good not only for breathing and coughing, it's actually a good point for nausea as well. The next point is 1 point. It's behind on the back. So Fred's just going to turn around and show us. I have demonstrated this point before in one of my previous videos. And the way you can locate this point is you take your left arm and you feel all along the top of the scapular bone. So you feel the top of your scapular bone until you reach the edge of it. Then between the edge of that bone and your spine, about the middle, is a pressure point. You will feel it, it will be sensitive. And while you breathe and hold that point, you can drop your chin and take 5 deep breaths. This is good for coughing, opens up the chest, and supports the body when you have your upper respiratory tract infections. We'll find the same point on the opposite side at the back. The next point we're going to do is another point I've done previously, is kidney 27. It's situated just below the collarbone. You can use your fingers or you can massage with your thumbs. And hold for at least 5 breaths. If you are having an asthma attack, you can use big circles and massage it quite vigorously to relax that large muscle that helps your lungs expand and contract. The next point is just further along under the collarbone. So if you follow your fingers along to the end where your arm joint, your shoulder joint meets, and you'll feel there's a indentation next to the chest muscle before you get to the shoulder joint. It almost has a triangular shape. So it's about the 3rd outer section of your collarbone, just below, and about 3 fingers down. So use your finger to find that point. It's just on the outside of the nipple line. You can work in a sort of 1 centimeter radius till you find the most sensitive spot. You can use your thumbs on both sides and just apply a nice, deep, sustained pressure. This improves our breathing function, it opens up the lungs, also good for coughing, and it releases emotions. This is an emotional point along this meridian. Sometimes in Chinese medicine, they refer to this point as the area in the body where we store tears. So we want to hold these points for up to 5 minutes. So find a comfortable position, make sure you relax, and just apply nice, deep, sustained pressure. While we're holding these points, I would just like to share with you, in Chinese medicine, as I said, we breathe in lung qi, and this qi is our life force energy. It feeds our bodies, its systems, our cells, our organs, together with the food we eat. And when we breathe in air, we don't just breathe in oxygen, we breathe in life force energy, and it gives our body about 30% of our energy. The rest comes from the food we eat. This relieves tight-chestedness, emotions, and the lungs are associated with grief and loss, just a sense of loss. And at this particular time during Corona, the world is suffering a lot of grief. We've lost loved ones all over the world, and everybody's grieving. We are also grieving the loss of our lifestyle, where some of us are in lockdown, and we have lost that normal routine and lifestyle that we were used to. We're sitting in isolation at home. Many people have lost jobs. Many people can't work. There's an element of grief and loss, and this can affect our lungs and our immune system. The last 2 points I want to demonstrate are still on the lung meridians, but they're on our hand, on the inside, on the inner aspect of our hand, following the thumb. This is where our lung meridian goes all along the upper arm into the shoulder and circulates around the chest. So if you look closely, one point is in the center of the muscle that's on the base of the thumb. This point's good for coughing, shortness of breath, and expelling phlegm from our lungs. And the second point is on the crease. If you fold your wrist over where there's the crease, there's an indentation. You will feel it with your finger. It's between the tendons. You can actually hold these points together if you want to. It helps clear the lungs, it relieves coughing, and it is a good point for sore throats. I also want to just end off, share with you a meditative breathing exercise, and this is to open up and expand our lungs, but it's also to mentally, emotionally open up and expand to today. Breathe in life today, breathe in life's opportunities, and let go. As we exhale, we just let go. Let go yesterday, let go the past, let go all our sadness and feelings of loss, and just invite new opportunities today. Sit in a nice comfortable posture with your back straight, your stomach muscles supporting your spine so that you don't collapse and your chest does not collapse in. As we breathe in, we raise our arms all the way up to above our heads, clasp our fingers, turn our hands so palms are facing outward, and we look up towards our hands and up towards the sky and breathe in. And when we exhale, we will use the sounds like a snake. Sound is a vibration, and that sound vibrates with our lung chi. So breathe in. And repeat this 5 times. And then bring your arms back down to your side and relax. There are other things we can do mentally and emotionally to support our lungs and to be able to breathe in. One of them is just to spend time outdoors, consciously breathing, allowing your skin to be outside, to breathe, the pores in our skin breathe. So expose your body to the outside and the elements, sit in the sunshine. You can mentally clear your lungs by doing a little bit of spring cleaning. It is springtime, so it's the best time of the year to do this. Tidy your house, clear the cobwebs and the dust from the corners of your home. I'm sure you know that when you clean your house, tidy your house, clear the dust, it feels like the room has a fresh breath of air in it, and giving your home some fresh energy. Another exercise you can do is using a dry brush and just brushing all your skin. It stimulates the surface of the skin. When we stimulate our defensive chi under the layers of our skin, we stimulate our lung chi, so that supports our breathing. Thank you for joining me today. Please share, like, and subscribe to my channel if you want more.